Okay, guys and girls, today we are going to talk about acne, and this is going to be in two different parts. So, this is acne part one. So, let's get started. And what do we know about acne? I bet you everybody knows a lot about acne because basically everyone has had acne. How common is acne? Acne is the most common skin condition in the United States. And I bet you every single person here has had acne to some severity or another at one point in their life. So it's the most common skin condition in the United States. How common is it? 85% of people, of all teenagers, okay, I said people, but everybody's a teenager at one time or another. Teenagers have this at some point in their life. Okay? So, let's get into some of the causes. So, acne occurs when skin cells inside hair follicles are shed. Shed means like they're coming off, they're falling off in higher than normal amounts. Okay? So, what's going to happen is, if you recall, we said that basically you have oil glands inside of hair follicles. So I'm going to draw a picture here real quick. Here's my hair follicle. It looks, I think they've actually called it a bulb before. Okay, so there's my hair follicle. And now I'm going to have my hair sticking out from here. Okay? And right next to this, I have an oil gland. Okay, so we have an oil gland. And so what happens is, normally as your hair grows, the oil comes out, it gets on your hair, and it makes your hair nice and shiny, right? Well, what's going to happen in acne is, for some reason, hair follicles are going to come off, and they're going to clog this up. But you're still producing oil. So what the oil eventually starts doing is it starts pushing this up and up, and then eventually it goes above the layer of the skin. And that's when you have acne, okay? So for the most part, we call this a whitehead. Now what can happen is, and I'm going to be writing all this down in notes, but what can happen is it can keep pushing it up, and eventually the integrity of the top layer breaks off, and so you get, this becomes oxidized. By the way, the white in the whitehead is the oil that you're looking at, basically. So what happens is this becomes oxidized and it turns black. And guess what we call that? We call that a blackhead, because it is black. Okay? So let's go through this. Okay, so the skin combines with the oil. The oil is called sebum. So the skin cells combine with oil, right? Which is sebum, which is what I'm going to call it from now on. So it's going to combine with sebum, and it clogs the hair follicle. Okay, like I just explained. Okay, so as the sebum accumulates, and that's what I just got done saying, sebum accumulates, take a guess of what it forms. So as the sebum accumulates, it forms a whitehead. So it forms a whitehead. Okay? And then as it, if the blockage breaks through the sebum, I'm sorry, breaks through the skin. If the blockage breaks through the skin, the sebum is oxidized. So what that means is you have oxygen molecules coming by and actually pulling electrons off of the oil, which is basically going to break it down. Okay, so the sebum is oxidized. And a blackhead forms. Okay, so a blackhead's going to form. Okay, so people may take topical agents and things such as that, acne medication that goes on the skin, and basically they will dry the skin out, but topical agents don't. Topical agents and diets, for the most part, I've had people who disagree with me about diets, but for the most part, they have no effect on sebum production. Okay? So they have no effect on sebum production. Now, the last thing is, what about hormones? If you notice, people who are most likely to get acne are people who are teenagers who are having the most types of hormone problems. So hormone-based contraceptives, or just hormones in general, but hormone-based contraceptives, and hormone changes. Remember, triangle means changes in science with age. Do affect sebum production. Okay, and that's the end of this for part one. So hormone-based contraceptives and hormone changes with age affect sebum production. So we'll come to part two.